Chifadi, thank you. Inadequate. That's the damning verdict inspectors have given the trust which runs Worcestershire's 3 main hospitals. Health watchdogs at the Care Quality Commission have said the entire Worcestershire Acute NHS Trust should be put into special measures. Well, our health correspondent, Michele Paduano, has been taking a look at what that means for patients and hospital staff.
Gareth Summers' experience epitomises all the Care Quality Commission found, but it happened after their damning inspection. The 40-year-old was taken to Worcester A&E after a motorbike accident in October, but was sent home the following day.
It didn't examine me, it didn't do no scans or anything. And I couldn't walk. I couldn't even get off the bed, let alone try and walk. I couldn't even do that to get anywhere.
You know?
36 hours later he collapsed but managed to call a neighbour. He had at least 6 fractured ribs, a fractured eye and a damaged spleen. He was dying.
He was sort of lay out straight and he looked in pain. And like I say, he was soaking wet, just like somebody had tipped a bucket of water over him, freezing cold, and it's horrible, sort of almost like, you know, ashen white.
Worcestershire Royal is expanding its A&E, which is under intense pressure. The Care Quality Commission identified a shortage of doctors and sending patients home too soon. Mr Summers was seen by an agency doctor.
They got hold of his agency and said he wouldn't be going to Worcester to work ever again.
Gareth spent 2 days in critical care, described by the report as outstanding. One nurse who worked there for 15 years and went viral when she challenged Jeremy Hunt to do her job said the pressure is immense.
It must be soul-destroying because day after day these nurses are going into work and they are trying their hardest. You know, nurses are working through breaks, they're working over the working day. You know, they're going home in tears.
This ward was also highlighted as outstanding in a bleak report which said outcomes for patients need to improve. Putting the hospital into special measures means they'll get assistance from other hospitals and some extra money. Pat Morris summed up the feeling of patients on the ward.
If I could ask for anything, they would do it for me.
So although there is care and compassion, the hospital has a long way to go before it's safe.
Michele Paduano there. Well, the Worcestershire Acute Trust is the 6th NHS trust in our region, judged to be failing in recent years. The others are the Wye Valley NHS Trust, which runs Hereford County Hospital, the Heart of England NHS Trust hospitals in Birmingham and Solihull, the Shropshire Clinical Commissioning Group in Shrewsbury, the Black Country NHS Partnership Trust, which provides mental health and community care from its base in West Bromwich. But at least there was some good news for patients in Staffordshire in October when Burton Hospital's NHS Trust came out of special measures after 2 years. But tonight we can add the Alexandra Hospital in Redditch, Kidderminster Hospital and the Worcester Acute, where Michele is right now. So Michele, what reassurances are hospital bosses able to give to patients tonight?
Well, some, but that list shows that this problem is actually contagious. And there are 2 reasons for that: an ageing population and a shortage of money. But I do think that the problems in Worcestershire are far more deep-seated. And part of the reason for that is this hospital was actually built too small. The issue too is that when you go into special measures, it's actually more difficult to attract staff. But the chief executive here said despite all that, he is sure that the hospital is actually moving in the right direction.
If you focus on the areas which the CQC said were the areas of most concern, and that was our maternity and paediatric services, they were the areas that were under the most stress. They were the areas which we've said for some time need to change, and they're the areas that indeed have changed very recently, as you will know, where we had to put temporary suspension in place. My sense, and again the CQC report bears this out, is the staff in there were delivering outstanding care. That's what the report says, despite all of the challenges. And I think what the staff were doing there was, in a crisis, concentrated on the urgent rather than the important. So the governance not being effective was about how those staff were looking at lessons, learning the lessons and cascading those back. Absolute basics, and we accept responsibility for that. But I think it was probably symptomatic of the risk and the fragility of those services at that time. But if you were to look at the services now, I think they're completely unrecognisable. They're more resilient, they're stable, and the staff are doing the basics really well.
I understand that politicians knew about the decision to go into special measures long before the hospital itself. And there's another side to special measures. It means that you can actually make changes far more quickly. And that may have an impact on the campaigners in Redditch who want to keep maternity and children's services there, because they may have to move to keep the services here overall safe.
Michele, thank you. Two schools